Hello everyone, welcome to our channel. If you're one of the many people constantly clearing their throat or feeling like there's always a layer of mucus that won't go away, you're not alone. This issue can be frustrating, uncomfortable, and even embarrassing at times. In this video, we'll explore the various factors that can contribute to this problem, backed by scientific research and expert opinions. Our goal is to provide you with a thorough understanding of what might be causing your persistent throat mucus and what you can do about it. But before we dive in, it's essential to remember that while this video contains valuable information, it should not replace professional medical advice. If you're experiencing severe or prolonged symptoms, it's always best to consult your healthcare provider for personalized guidance. With that said, let's start on this journey to understanding the causes of constant phlegm and mucus in the throat. 1. Postnasal drip. Postnasal drip is one of the most common causes of persistent mucus in the throat. It occurs when excess mucus produced in the nasal passages and sinuses drips down the back of the throat, causing irritation and the urge to clear the throat repeatedly. Various factors, such as allergies, cold temperatures, spicy foods, and certain medications, can trigger postnasal drip. When you encounter allergens or irritants, like pollen or dust, your nasal passages become inflamed and produce more mucus as a defense mechanism. This excess mucus trickles down your throat, leading to the annoying feeling of needing to clear your throat constantly. Allergic rhinitis, or hay fever, is a prime example of how allergies can cause postnasal drip. When your immune system overreacts to normally harmless substances, it releases chemicals that cause your nasal passages to swell and produce extra mucus. Cold temperatures and dry air can also cause your nasal passages to produce more mucus, so that you might notice more throat clearing during winter or in air-conditioned spaces. Spicy foods can have a similar effect, irritating your nasal passages and causing them to produce more mucus. Some medications, like blood pressure drugs, birth control pills, and antihistamines, can also contribute to postnasal drip. These medications can cause your mucous membranes to become dry or irritated, making your body produce more mucus to compensate. Talk to your doctor if you think your medication might be causing your throat mucus. They can adjust your dosage or suggest an alternative medication. 2. Acid reflux. Another common cause of persistent throat mucus is acid reflux, also known as gastroesophageal reflux disease. This happens when the muscle between your stomach and esophagus, the tube connecting your mouth and stomach, doesn't close properly, allowing stomach acid to flow back into your esophagus. This backflow of acid can irritate your throat, causing inflammation and increased mucus production. If you have acid reflux, you might experience symptoms like heartburn, chest pain, and a sour taste in your mouth, along with constant throat clearing. If acid reflux is behind your throat mucus, it's worth talking to your doctor. They can help you find the best way to manage your symptoms. Acid reflux can be triggered by certain foods, like spicy or fatty meals, obesity, pregnancy, and a type of hernia called a hiatal hernia. Lifestyle changes, such as avoiding trigger foods, eating smaller meals, and not lying down right after eating, can help control acid reflux. 3. Chronic respiratory conditions. Certain long-term respiratory conditions, like asthma and chronic obstructive pulmonary disease, can also lead to excess mucus production in the throat. These conditions cause ongoing inflammation in the airways, which can make the mucus glands produce more mucus than usual. Asthma is a condition in which the airways narrow and swell, making breathing difficult. During an asthma attack, the muscles around the airways tighten, and the airways produce extra mucus. This excess mucus can drip down the throat, causing frequent throat clearing. COPD, which includes conditions like chronic bronchitis and emphysema, damages the lungs and airways. This damage leads to chronic inflammation, which makes the airways produce more mucus. The excess mucus can build up in the lungs and throat, causing coughing, wheezing, and constant throat clearing. Managing chronic respiratory conditions often involves lifestyle changes, medication, and breathing exercises. Inhaled medications can help reduce inflammation and open your airways, making breathing easier and decreasing mucus production. Pulmonary rehabilitation programs, including exercise training and breathing techniques, can also help improve lung function and reduce mucus buildup. 4. Infections. Infections of the respiratory tract, both viral and bacterial, can also cause increased mucus production and throat irritation. The common cold, flu, and sinus infections are all examples of infections that can lead to excess mucus. When your body detects harmful invaders, like viruses or bacteria, it ramps up mucus production to help trap and remove these pathogens. During a viral infection, like the common cold or flu, your nasal passages and airways become inflamed. This inflammation causes your body to produce more mucus, which can drip down the back of your throat, causing irritation and the need to clear your throat frequently. While this excess mucus is a normal part of your body's defense system, it can be annoying and uncomfortable. Bacterial infections, like sinus infections or strep throat, can also increase mucus production. When bacteria invade your sinuses or throat, your immune system responds by producing more mucus to help flush out the harmful microbes. A bacterial infection can sometimes develop following a viral infection, prolonging your symptoms. Treatment for respiratory infections depends on the cause. Viral infections, like the common cold and flu, typically go away on their own with rest, hydration, and over-the-counter symptom relief. Bacterial infections, on the other hand, may require antibiotics to clear the infection and prevent complications. If your symptoms are severe or long-lasting, it's important to see your doctor. They can help determine the best course of treatment for you. 5. Dehydration. Dehydration is another factor that can contribute to persistent throat mucus. When your body doesn't have enough fluid, the mucous membranes in your throat and airways can become dry and irritated. In response, your body may produce thicker, stickier mucus to lubricate and protect these surfaces. This thicker mucus can be harder to clear and may lead to frequent throat clearing. Staying hydrated is key to keeping your mucous membranes healthy and your mucus thin and easy to clear. Aim to drink at least 8 glasses of water daily, and more if you're exercising or spending time in hot, dry environments. Hydrating fluids like herbal tea and clear broths can also help. In addition to drinking enough water, using a humidifier can help add moisture to the air and prevent your mucous membranes from drying out. This is especially helpful during winter when indoor heating can dry the air. 6. Environmental irritants. Environmental irritants, such as air pollution, smoke, and chemical fumes, can also contribute to the development of persistent throat mucus. Breathing in these irritants can cause inflammation and irritation in your airways, increasing mucus production. Environmental exposure, such as smog and vehicle exhaust, can be especially problematic for people living in urban areas or near busy roads. These pollutants can contain harmful substances that irritate mucous membranes and trigger increased mucus secretion. Similarly, exposure to secondhand smoke or smoking yourself can significantly impact mucus production in your throat. The chemicals in cigarette smoke, like nicotine and tar, can cause inflammation and damage to the delicate tissues lining your airways, leading to a chronic increase in mucus production. Quitting smoking and avoiding exposure to secondhand smoke can help reduce the burden on your airways and improve your overall respiratory health. Workplace exposure to chemicals, dust, or other irritants can also contribute to persistent throat mucus. People who work in industries like manufacturing, construction, or mining may be at a higher risk of developing respiratory irritation and increased mucus production. Wearing protective gear, like respirators or masks, can help minimize exposure to these irritants. In conclusion, various factors can contribute to constant phlegm and mucus in the throat. From postnasal drip caused by allergies and irritants to acid reflux and its effects on your throat, understanding the root cause of your symptoms is crucial for finding the most effective relief. We've also discussed how chronic respiratory conditions, infections, dehydration, and environmental irritants can all affect excessive mucus production. If you've been struggling with persistent throat mucus that impacts your daily life, remember that you don't have to deal with it alone. Talk to your healthcare provider about your symptoms. They can help identify the underlying cause and develop a personalized treatment plan. Respiratory health is vital to your overall well-being and deserves attention and care. By staying informed, making healthy lifestyle choices, and working with your healthcare team, you can effectively manage the challenges of constant throat mucus and improve your quality of life. Thank you for watching this in-depth guide on the causes of constant phlegm and mucus in the throat. If you found this video helpful, please share it with others experiencing similar issues. Don't forget to like and subscribe to our channel for more science-backed health content. Until next time, take care and breathe easy.